All right, welcome to the Deep Dive. We're here to help you get well-informed, fast, on some pretty complex stuff. And today, we're diving into something really fascinating. How sociology's view of health, illness, and even the body has, well, really shifted over time. We're drawing heavily from a review by Nick J. Fox, looking at this journey from what's called post-structuralism towards new materialisms. Now, this isn't just abstract theory. It really gets under the skin of how we define health, how we experience sickness day to day. Why should you care? Because honestly, it challenges a lot of what we just assume about our bodies and, our healthcare experiences.
Yeah, precisely. We'll be exploring how these big intellectual shifts have fundamentally changed the questions sociologists even ask about health. It's a move from looking mainly at language, discourse, sort of cultural narratives.
Where they talk about things.
Exactly. Towards the more tangible physical realities, the stuff that actually affects our well-being directly. And what's really interesting, I think, is how this reframes everything: sickness, healing, even the basic idea of being healthy.
Okay, let's try and unpack this. So the starting point you mentioned is post-structuralism. Sounds a bit academic, maybe.
It was a huge influence, yeah, for decades in health sociology. At its core, the argument was that health and illness aren't simply, objective biological facts just waiting to be discovered. Instead, they get shaped, they're constructed through systems of power and knowledge. Think Michel Foucault, a key figure here.
Right. Foucault, the medical gaze.
Exactly that. It's not about doctors being intentionally controlling, necessarily. It's more about how medical science itself, through detailed records, diagnostic categories, all that creates this powerful way of seeing and understanding bodies.
Like a lens.
A lens, yeah. And that lens defines what's normal, what's pathological. It subtly shapes how patients get viewed, how they get treated. It's a kind of micropolitics.
So it's less about the disease itself and more about how society frames it, defines it.
That's a big part of it.
Yeah.
And then you have someone like Jacques Derrida taking it maybe even further. He suggested our whole grasp on reality is filtered through language, through symbols. You might have heard his famous line, "There is nothing beyond text."
Which sounds pretty extreme.
It can sound that way. But for health, it implies that concepts like wellness or disability aren't fixed truths. They shift based on how we talk about them, who has the authority to define those terms.
Ah, okay. So it makes you question those definitions.
Definitely. It led to challenging what they called logocentric propositions, these claims to absolute truth, whether from science, religion, whatever. Critiquing how the standard biomedical model empowers certain professionals and defines the body in very specific ways.
But, okay, here's a question. If it's all text, all discourse, what about the actual physical reality of being sick? The pain, the virus, does that just get ignored?
That's exactly the critique that emerged. A really important question. Did post-structuralism maybe go too far and kind of sideline the raw materiality, the actual flesh and blood?
The messy stuff.
The messy stuff, yeah. And that questioning paved the way for what's now called the new materialisms.
Okay, new materialism, so a different approach.
A different focus, perhaps. It still looks at power, absolutely, but it shifts the lens firmly onto matter itself, the physical world. New materialists argue that matter isn't just passive clay shaped by culture. Nature and culture are, like, intertwined, not separate boxes.
Right.
And here's a really interesting bit. They argue that agency, the power to act, to make things happen, isn't exclusive to humans.
Wait, so non-human things have agency? Like what?
Like, say, a specific drug, or the layout of a hospital ward, or a piece of diagnostic tech. These aren't just passive tools. They actively participate in shaping health experiences. They do things.
Huh. So it flips from just asking, what is a body, to what can a body do? Is that the idea?
That's a great way to put it, exactly. Thinkers like Deleuze and Guattari talked about a relational ontology, fancy term, but it just means your body isn't this isolated machine.
It's connected.
It's understood through its connections, biological, psychological, cultural, technological. It's all a network. They call this an assemblage.
Okay, assemblage. Give me an example.
Right, so an ill health assemblage. It's not just you plus a disease. It's your body, the illness itself, the doctors, the meds, the scanning machine, maybe your family duties, your friends supporting you.
A whole network.
A whole network.
Yeah.
And the illness experience is shaped by all the interactions, the possibilities and limitations within that specific assemblage.
Which implies health isn't just, ticking a box saying not sick.
Precisely. It's more dynamic. It connects to this idea of a health assemblage. Health, in this view, is about the proliferation of a body's capacities to affect and be affected.
Wow, okay. Affect and be affected.
Yeah, it's a relational achievement. It
Yeah.
depends on all these forces, these connections, these ongoing struggles even. It's a constant process of becoming. You're always sort of rallying your capacities, pushing against limits, maybe finding new ways to function or feel well.
So, wrapping this up,
Mm,
what's the big picture here for you listening?
yeah.
It feels like a really significant shift, moving away from seeing health just through the lens of how we talk about it, the texts, the discourse, to understanding it as this really dynamic, deeply connected, and fundamentally material thing, your body interacting with everything around it.
Yeah. And maybe that leaves you with a question to ponder. If health isn't just about not having a disease, but about your body's ever-changing ability to interact with the world, to affect and be affected, what new ways of thinking about your own well-being, your own agency does that open up for you?
Something to think about. Thanks for diving deep with us on The Deep Dive.